So I received an email a few days ago from somebody who watches BBC, I guess, quite regularly, and he suggested a topic that has to do with current events, because he said he was watching the Supreme Court hearings about the healthcare law. And he said that, I haven't listened to them, okay, but he said that one side appeared to be like a whole teaching on Dukkha, you know, the unsatisfactoriness of samsara. And the other side seemed to be like a whole teaching on karma. So I guess the side on Dukkha was, you know, we all have bodies, so we all get sick, so we all should be participating in health insurance and together, because it pertains to all of us, because all of us have bodies like that, and none of us are going to go through our lives without any kind of sickness. And then I guess the other side was talking about karma, saying everybody does their own individual thing, and you reap the result of what you do individually. Okay? So he was saying that the whole thing, he was listening to it, and he said it could have been a Dharma talk. Yeah. But I think the two things can be brought together. We shouldn't, you know, talk about dukkha or, you know, unsatisfactory conditions and karma as two separate things, okay? Because, yes, we all have bodies, so we're all going to get sick. And also, yes, we're all creating karma that's going to result in our getting sick, you know. And if we have an attitude of helping other people when they're sick, then when we're sick, we're going to receive the medicine and help we need. Whereas if we have this attitude of karma, of, you know, well, I just create my own karma, and so what you guys do is your own business and you reap the result of it, you know, and we don't have an attitude of compassion blended in with that, then what's going to happen is we're going to create the cause for ourselves not to receive the kind of care that we need when we're sick, you know. And what we're doing instead is just really increasing our self-centered mind that feels like we're individual units in a society. And it seems to me that we have very much that view in the West, that people are just individual, unrelated units to everything else. And so this whole American thing of pick yourself up by your own bootstraps. But, you know, who made the boots? Yeah, and when you pick yourself up, who made where you're picking yourself up to? And who taught you how to pick yourself up? And who was giving you the opportunity to pick yourself up? So I think, you know, this idea that we're just individual units in society and what happens to other people doesn't really matter to us is really, really incorrect, you know? And I found it quite interesting that, you know, the people who are saying they really want to downsize the entitlement programs and cut Medicare and Medicaid and government expenses that way, that many of these people don't realize that they are also receiving government help. You know, they're just thinking that that government help is for people who are very, very poor, but not for them. But in fact, they are the ones going to the VA, getting government help for their medical thing. They're the ones who are collecting unemployment insurance, you know, or if they get injured, getting L&I help for their injuries. And so I think many people aren't realizing how much the government is helping the middle class, you know, not only the people who are very poor. So I think if these entitlement programs get cut, the middle class is going to have a very big wake-up call with a lot of people suffering who don't realize at this particular time, you know, how interrelated we all are and how much, you know, they are receiving help from the government. And to me, when I think of receiving help from the government, I think of people receiving help from everybody. Yeah, I don't see the government as like some outside thing. You know, they happen to be the one collecting the money and then distributing it to whoever happens to need it most at this particular time. Yeah, and to me that seems fine. You know, at some times it's not me who needs it, so I'm happy to create the good karma by helping other people. And sometimes it is me who needs it, at which time I'm quite grateful to other people for extending a hand and helping me. Yeah, so I think, you know, our Buddhist values can be brought into, you know, this whole public policy debate that we're going through right now, with an attitude of patience and compassion and tolerance. Okay.